How to make a differential diagnosis for USMLE Step 2 CS. Are you preparing for the United States Medical Licensing Examination Step 2 clinical skills and wondering how to make a differential diagnosis? You're in the right place. Let's break it down step by step. First, you need to gather relevant information during each patient encounter. You have a time limit of 15 minutes, so efficiency is key. Start with the chief complaint. Ask the patient what brings them in today. Then, dive into the history of present illness. This is where you learn more about the symptoms and how they have progressed. Next, collect the past medical history. This includes any previous illnesses, surgeries, or ongoing conditions. Don't forget to ask about medication use and allergies. Understanding the patient's social history is also important. This includes substance use and sexual history, as these can impact health. Once you have the history, perform a targeted physical examination. Focus on the areas that relate to the patient's symptoms. This thorough data collection is essential for your diagnostic reasoning. After gathering the information, identify key positive and negative findings. These findings will help you differentiate between potential causes of the symptoms. From this, generate a list of up to 3 differential diagnoses. Make sure these diagnoses reflected both common and serious conditions relevant to the patient's presentation. For each diagnosis, note the supporting clinical features. Also, include findings that argue against other diagnoses. This shows that you can weigh evidence critically. It's not just about listing possible conditions, it's about understanding why some are more likely than others. Next, propose initial diagnostic tests or procedures. These should help confirm or exclude each diagnosis. Ensure that the tests are appropriate and justified by the clinical scenario. Remember, the focus here is on diagnosis and diagnostic strategy, not treatment. After each encounter, you will document your findings in a patient note. You have 10 minutes to complete this note. It should include relevant history, physical exam findings, and your differential diagnoses with supporting evidence. Practicing clinical reasoning with standardized patient cases is a great way to prepare. Review common presentations across different specialties like internal medicine, surgery, pediatrics, psychiatry, and obstetrics or gynecology. Time management and clear communication are also essential for success in this part of the examination. By following these steps, you can effectively make a differential diagnosis for the United States Medical Licensing Examination Step 2 clinical skills. Remember, practice makes perfect, and each encounter is an opportunity to refine your skills.